This lecture is about GI clinic workflow, documentation, and patient education. By this point in the day, you have heard about anatomy, symptoms, conditions, procedures, and medications. Now we need to connect all of that knowledge to what actually happens in a real clinic day. This is the session where GI knowledge becomes workflow skill. Let's begin with an intake and rooming in GI clinic, or EA. In GI practice, details that might seem small in another setting often matter a great deal. If a patient has diarrhea, the provider will usually need more than diarrhea for 2 weeks. Useful documentation might include stool frequency, stool consistency, blood or mucus, nausea or vomiting, appetite, weight change, pain location, food triggers, prior GI procedures, and medication use, including over the counter medicines, NSAIDs, anticoagulants, and supplements. Alcohol and tobacco use may also matter depending on clinic workflow. That means good intake is not just moving quickly, it is gathering the details that make the visit useful. After rooming and intake, another major workflow area is procedure scheduling support. GI clinics often depend on very clear instructions around colonoscopy prep, fasting, follow up reminders, ride requirements, and rescheduling if instructions were not followed. An MA may help reinforce prep instructions, answer routine questions within role boundaries, and identify when a misunderstanding could affect whether a procedure should go forward. Now let's consider the pathology and lab tracking. In GI practice, biopsy specimens and lab results can drive major follow up decisions. That means specimen workflow, result routing, and follow up coordination have to be dependable. You may not be the final decision maker, but your documentation and handoff accuracy matter. Another workflow area is prior authorization and specialty medication support. This may involve biologics, advanced imaging, or specialty procedures. The key MA lesson here is not the insurance policy details. It is that delays, missing documentation, or weak handoffs can interrupt care. Now let's move to standardized patient education, which is a major part of GI workflow. Common teaching topics include bowel prep, heart or reflux lifestyle guidance, constipation self-care basics, medication instructions, and a discharge instructions after sedation. If patient education is vague, rushed, or full of jargon, the risk of confusion goes up. That is why plain language matters. Your hurts as it were, or as in where right version where microchestes or anybody avoid medical jargon when simpler words will work. We used to use teach back and ask the patient to explain the plan in their own words. Use professional interpreters when needed and do not rely on family as the interpreter when proper interpretation is available. Also remember that bowel symptoms are sensitive. Patients may give more honest answers if you normalize the conversation and speak respectfully. Cultural humility and patient trust matter here. Some patients are embarrassed, some are anxious about procedures, some may have trauma histories that affect how they respond to bodily questions or invasive testing. Calm, respectful communication can make a real difference. Let's review common pitfalls for new MAs in GI clinic. Poor bowel prep teaching, incomplete medication review, missing red flags, specimen labeling errors, infection control mistakes, role confusion, and not escalating urgent symptoms soon enough. Notice that many of these are workflow failures, not knowledge failures alone. So, what does strong performance look like? It looks like specific documentation instead of vague notes. It looks like clear teaching instead of rushed instructions. It looks like using teach back instead of assuming understanding. It looks like noticing when a routine workflow issue is actually becoming a patient safety issue. The practical takeaway from this session is simple and it is worth repeating. In GI clinic, workflow quality is care quality. Good intake, good teaching, good handoffs, and timely escalation all help keep patients safe.